briefly hearing music, I'll begin with the introduction and turn the conference over to you, Mr. Parker. One moment, please.
Hey, Jennifer?
Yes. Yes.
You're going to transfer me to the communications line?
Yes.
Thank you.
Simon, before we get started, I'm with Single Payer Action, and I was going to ask you a question. Why do you oppose single payer for the United States?
That's a question I'd be delighted to talk to you after this meeting, but we're here to talk about something a little different.
Right. Well, you're talking about controlling costs.
Sure.
And the proponents of single payer in the House, for example, they say that it would save $400 billion a year and cover everyone. Unfortunately, it would put your company out of business. Is that the reason why you oppose it?
I've had experience working in single-payer systems and in
Yes, sir.
non-single-payer systems.
Can you
and
actually
there
just
are
go back to the
pluses
whole
and
line,
minuses of
please?
each, and I'd be happy
Yeah.
to talk to you
Okay,
a bit
one
more
moment.
about what those pluses and minuses are when we've dealt with the business which we're here to talk
Right,
about
but
today.
this is one more thing. 60 Americans die every day from lack of health insurance. And so if you delay more, those 60 Americans will continue to die. As in Canada, nobody dies from lack of health insurance.
Our view is there should be universal coverage, and that's why we've supported a range of changes to the US healthcare system to get that universal coverage for everybody. And I'd be happy to talk to you afterwards when we've dealt with what we're here to talk about how we should do that.
Who are you?
Russell Mokhyber from Single Payer Action.
Okay, Mr. Parker, I have put the participants back on music hold. Is there a problem?
No, we're just getting organized.
We're
ready to go.
waiting for this. What I don't understand is the set of volunteer. Did you see the Bill Moyers thing recently? I mean, he goes through every administration that attempts some kind of healthcare reform. There's all this talk of voluntary this and Johnson, Carter, Clinton, and so on, and it never.
Excuse me, can I just?
It never matriculates.
We'd like just to
So
get this.
Is that really a solution? What you're putting forward?
This is a conversation I would very much like to have, and let's have it after we've dealt with what we're here to deal with, and then let's have that conversation.
Isn't that the conversation?
No, it's a conversation, but it's not the conversation.
I mean, you're talking about healthcare reductions here and so on, and
Okay.
it's all in this voluntary framework.
We need to
And
make
everybody's supposed to trust the insurance companies that,
No.
you keep you in the saddle, and hopefully everything will turn out all right.
It's not just a set of voluntary programs which is being talked about here. We think there should be
I'm at the
changes
event
to
right now, so
regulation
I'll try
and
to
to law.
record,
And
all
I'd
right?
like to talk to you about what those should be.
Yes. I think I might have a call on
Are we?
but
I think we're ready to go.
I need to jump off because I'm disrupting this event, so.
Okay,
all right,
we're ready to connect.
Okay, you're ready to be transferred now?
Yes, please.
Mr. Parker,
Yes.
you ready to go?
Yep.
Okay, I'm transferring you now. I'll begin the introduction and turn the call over to Mr. Parker. One moment, please.
Great, thank you.
Good afternoon. Thank you for joining today's UnitedHealth Group conference call on the release of the UnitedHealth Group Center for Health Reform and Modernization Health Care Cost Savings Report. The conference will begin with